combination syndrome. So combination syndrome is also called as Kelly syndrome. So it is a dental condition that is commonly seen in patients with completely edentulous maxilla and partially edentulous mandible with preserved anterior teeth. So negative pressure within the maxillary denture pulls the tuberosities down, by which the anterior ridge is driven upward by the anterior occlusion. So thereby functional load will then direct stress to the mandibular distal extension. So there is a stress to the mandibular distal extension cases. So the mandibular distal extension resulting in bony resorption of the posterior mandibular ridge and supra-eruption of the mandibular anteriors and occlusal plane discrepancy, loss of vertical dimension of occlusion and chronic stress result in all ill-fitting prosthesis. So the main disadvantages of combination syndrome is result in ill-fitting denture. So Kelly was the first person to use the term combination syndrome. So he believed that the key to many symptoms of the combination syndrome is the early loss of bone from the anterior part of the maxillary jaw. So this is the reason. Early loss of bone from the anterior part of the maxillary jaw. So other consistent features of this dental condition include, so there is an enlargement of the maxillary tuberosities and mandibular posterior bone resorption. These are the other consistent features. It may or may not be present in combination syndrome condition, but there is a definite resorption of the mandibular distal extension cases. There is a classification is in combination syndrome. So class 1 is maxilla. Maxilla is completely edentulous, alveolar ridge and mandible. There is 3 modification. The first one is partially edentulous ridge with preserved anterior only. So the second modification is there is a stable fixed full dentition. There is natural dentition or implant supported crowns or bridges. It is a second modification, and third modification is partially edentulous ridge with preserved teeth in anterior and one posterior region. This is the third modification in mandible. So this is the first classification. And class 2 is in maxilla, there is partially edentulous alveolar ridge with teeth present in both posterior region, edentulous and atrophic anterior region. So here anterior region is edentulous. In mandible, modifications are the same as in class 1. There is M1, modification 1, 2 and 3. So there is a partially mandible with anterior teeth, something like that. So same as class 1. And in class 3, there is maxilla, partially edentulous alveolar ridge with teeth present in one posterior region only, and edentulous atrophic anterior and posterior and one posterior region. So in mandible, modifications are consistent with class 1 and class 2. There is a M1, M2 and M3 conditions. So this picture showing the class 1, that is M1, M2 and M3. The first one is in maxilla, completely edentulous arch. So the first one is partially edentulous arch, but there is presence of anterior teeth. And the second one is there is a fixed full lower dentition in mandible. And the third one is partially edentulous mandible with teeth present in anterior and posterior region. And let's moving on to the class 2. So there is a partially edentulous arch, but in maxilla there is teeth present in only the posterior region. That is class 2. So class 2 maxilla is different. There is partially edentulous maxilla with teeth present in both posterior region. But in class 1 there is maxilla, completely edentulous maxilla. And next moving on to class 3. In maxilla there is partially edentulous maxilla with teeth present in posterior region only. Here there is 4 classification or 4 modification in mandible. The first one is partially edentulous mandible with anterior teeth present only. And the second one is fixed to full lower dentition, and the third 3A is partially edentulous mandible with teeth present in anterior and occluding posterior region, and 3B, and the second modification of third one is partially edentulous mandible with teeth present in anterior and non-occluding posterior region. So the dominant feature of most CS cases is edentulous premaxilla with an advanced resorption of anterior maxillary bone and overgrowth of the anterior mandibular bone with extrusion of the lower front teeth. So here the key point is edentulous premaxilla and advanced resorption of the premaxilla and supra-eruption of the lower anteriors. So treatment, systemic and dental considerations. So we have to review medical history and dental history, and clinical and radiographic evaluation of both hard and soft tissues is needed, and resolution of any inflammation if present. We have to give the result for that inflammation. We have to give the antibiotics and gels, something like that. So evaluation of patient's caries so we have to evaluate the patient's caries susceptibility and periodontal status and oral hygiene, and factors to be considered in tooth to be used as a abutment. Mostly the abutment tooth have to be fixed and non-motile. So Kelly said that before proceeding with the prosthetic treatment, gross changes that have already taken place should be surgically treated. So these include conditions like if flabby tissue, that is hyperplastic tissue, and lower partial denture base should be fully extended and should cover retromolar pad area and buccal shelf area. These are the considerations. So next, moving on to basic treatment objectives. So what are the basic treatment objectives? Treatment planning for completely edentulous maxillary arch. So we have to restoring a stable posterior occlusion while minimizing occlusal pressure on the anterior maxilla. So minimize the occlusal pressure on the anterior maxilla, and planned extractions followed by immediate dentures or preservation of a few of the remaining teeth for the fabrication of overdenture prosthesis with a metallic denture base for one arch are preferred treatment modalities. So here the important key point is we have to give minimal pressure to the anterior region, maxillary anterior region. So this decreases the risk for occurrence of combination syndrome by preventing a completely edentulous arch from opposing natural teeth. So the first treatment option is planned extractions followed by immediate denture. We have to give immediate denture. So this is the simple reason or simple prevention for combination syndrome. And the second option is overdenture prosthesis with a metallic denture base. We have to give metallic denture base with overdenture prosthesis. And the third option is conventional prosthodontic techniques with special consideration for flabby tissue. There is special impression techniques or special consideration for flabby tissue. So treatment option 4 is surgical intervention. So we have to do vestibuloplasty and excision of the flabby tissue followed by metallic denture base prosthesis. These are the 4 options, treatment options for completely edentulous maxillary arch. Next, moving on to treatment planning for the distal extension partially edentulous mandibular arch. What are the treatment planning for distal extension partially edentulous mandibular arch? So the main aim of prosthetic therapy is to restore stable occlusion with good facial height. So the main risk factors to consider in the partial edentulous patient are associated with the progression of periodontal disease, caries activity, and residual ridge resorption and functional problems. So we have to identify the risk factors. These are the main aim for prosthetic therapy. So the main aim of prosthetic therapy is to restore the stable occlusion with good facial height. Here the first treatment option is overdenture. So teeth that are considerably supraerupted would require alteration by shortening the crown and crowning or placing them under an overdenture to obtain a harmonious occlusion. So here we are seeing the lower jaw. There is two teeth that is supraerupted. That is, we prepare the canal and we are using the teeth as a lower overdenture with intracoronal retainers. This is the option 1. And the second option for distal extension cases are a removable cast partial denture. This is the second case. So this image shows lower precision attachment. And option 3 is implant supported fixed prosthesis. So these are the 3 options for distal extension cases. So this picture showing lower implant supported complete denture. So these are the 3 options for treatment planning for the distal extension partially edentulous mandibular arch. This is all about combination syndrome.